welcome to the deep dive. Today we're looking into something, well, probably sitting in your kitchen right now, that could be surprisingly risky for your dog. We're talking grapes, raisins, even currants.
Yeah, that's true. These aren't some exotic things, they're everyday foods. But for dogs, they can cause serious, serious problems.
Sounds almost unbelievable, doesn't it? Stuff we snack on without a second thought.
Exactly. You drop one, maybe even toss one thinking it's a treat, but nope, potentially very dangerous.
And this deep dive, it's really for you, our listener. We want to make sense of this, cut through the technical stuff and give you the clear picture. What are the risks? What should you do? We've pulled together info specifically on grape and raisin toxicity in dogs. Our mission, just boil it down to the key facts so you understand what's going on. Okay, so let's get into it. What exactly is this condition?
Okay, so basically it's a type of poisoning. We call it a toxicosis. It happens when dogs eat grapes or raisins, sultanas, or those little xanthe currants. They all come from the same plant family, Vitis vinifera.
Right, Vitis vinifera.
And while, there are maybe a couple of stories about cats or ferrets, almost everything we really know scientifically is about dogs. They're the main ones affected.
And does it matter what kind of dog? Like big dogs, small dogs, certain breeds?
That's another interesting thing. Nope. Seems like there's no specific breed or sex or even age that makes a dog more likely to get sick from this. It can happen to any dog.
Wow. Okay, so any dog is potentially at risk.
Yeah,
Yeah, that's important. So what are the first signs? If a dog has eaten some, what would you notice first?
Usually the first thing pops up within about 24 hours. Vomiting is really common. Often you might actually see bits of grape or raisin in the vomit, undigested.
Okay, so vomiting pretty quickly. What else?
Well, then you might see diarrhea start. Maybe they stop eating, which we call anorexia, just means no appetite. They might get really tired, sort of sluggish, that's lethargy. And sometimes they seem uncomfortable, like their belly hurts, abdominal pain.
And it's not just a little tummy ache that passes.
Right.
It can escalate.
Oh, absolutely. Sadly, yes. The really big worry is kidney damage. As the kidneys get affected, the dog gets dehydrated. They might start producing very little urine, that's called oliguria.
Oliguria, okay.
Or in the worst cases, they might stop making urine completely, anuria. And this kidney issue can show up anywhere from, say, 24 hours to even a few days after they ate the fruit.
And the outcome can be?
If the kidney failure is severe, it can be fatal. Or might lead to a decision for euthanasia, unfortunately.
That's incredibly serious. From just a few grapes,
Mm-hmm.
It makes you wonder, what is it in them that causes this? What's the toxin?
That's maybe the most baffling part. We don't know.
You're kidding. We don't know the actual substance.
Nope. The exact toxic compound and how it damages the kidneys, it's still a mystery. Research is ongoing, but we haven't pinpointed it yet.
Wow. Okay,
Oh.
So what about quantity? Is there like a magic number?
Yeah.
More than X grapes is dangerous.
Well, we do have some reported ranges from studies. For raisins, problems have been seen from about 2.8 up to maybe 9.6 grams per kilogram of the dog's weight. For grapes, it's a bit more, maybe 11 to 31 grams per kilogram. But, and this is super important, we haven't been able to set a definite minimum toxic dose. Meaning even a very small amount, maybe just 1 or 2 grapes or raisins, could potentially cause problems in some dogs. There's no known safe amount.
So any amount is a potential risk. You can't think, oh, it was only one.
Exactly. That's the critical takeaway. Assume any amount is risky.
That's worrying. And you also hear stories, or it's mentioned, that not every dog who eats them gets sick.
Yeah.
Well, the inconsistency, that seems strange too.
It is strange, and it adds to the puzzle. There are a couple of main theories. One idea is just individual sensitivity. Like people with allergies, maybe some dogs just react differently genetically or biologically.
Okay, that makes sense.
The other possibility is that the toxic substance itself isn't evenly distributed. Maybe it varies depending on how the grapes were grown, ripeness, the specific type of grape. We just don't know.
So the toxic lottery, basically.
Pretty much. You just can't predict if your dog will be one of the sensitive ones or if that specific grape has the toxin.
So the bottom line is, because of all this uncertainty.
Right. Because we can't pin it down, the advice has to be treat any known ingestion of Vitis vinifera grapes, raisins, sultanas, currants as a potential emergency. Even if there aren't specific toxic doses reported for, say, sultanas. Better safe than sorry.
Absolutely. Makes total sense. Okay, so let's say the worst happens, or you just suspect your dog got into the grapes. What does the vet do? How do they diagnose this?
Well, the first thing is to rule out other causes of sudden kidney problems. Acute kidney injury, we call it.
Because other things can cause that too.
Oh, yeah. Things like antifreeze poisoning ethylene glycol, that's a big one. Heavy metals, certain antibiotics like aminoglycosides, even common painkillers like NSAIDs if given improperly, also infections like leptospirosis, or even getting too much vitamin D. So the vet needs to consider all those
Okay,
possibilities.
ruling other things out, then what? Blood tests seem key here, right?
Definitely. Blood work gives us crucial clues, especially if it's done fairly early, like within 24 to 48 hours after ingestion. We look for increases in kidney values, mainly creatinine and blood urea nitrogen, or BUN. These are waste products the kidneys normally filter out.
So high levels mean the kidneys aren't working well.
Exactly. We also often see high phosphorus hyperphosphatemia and sometimes high calcium hypercalcemia. Interestingly, with grape toxicity, the creatinine and phosphorus often seem to rise a bit earlier than the BUN.
Ah, so the pattern of which values go up and when can help.
It can, yeah. For instance, if it was vitamin D toxicity, you'd typically expect the calcium and phosphorus to shoot up first, then the kidney values follow as damage occurs. With grapes, seeing creatinine and phosphorus climb early might point more strongly towards this specific cause.
Got it. Any other blood work changes?
Sometimes you might see hypotassium hyperkalemia, especially if urine output drops. Maybe elevations in amylase and lipase, which could suggest pancreas involvement, or ALT, hinting at the liver, but the kidney markers are usually the main focus.
Okay. What about urine tests? What do they show?
Urinalysis is also really helpful. We look to see if the kidneys can still concentrate urine properly. If they can't, the urine will be dilute. We call that isostenuria or hyposthenuria.
Meaning the kidneys aren't filtering and concentrating like they should.
Right. You might also find protein in the urine or blood or even glucose, which shouldn't normally be there if the kidneys are healthy. And under the microscope, sometimes we see things called granular casts. These are like little molds of the kidney tubules formed when there's damage inside.
Okay, so blood and urine tests paint a picture of kidney distress. And if they could look at the kidney tissue itself.
If a biopsy were done, which isn't common for diagnosis but might happen post-mortem, you'd see damage specifically to the renal tubules. Acute tubular necrosis is the term, direct injury to the kidney's filtering machinery.
Okay, so diagnosis involves ruling things out and looking at these specific kidney markers. Now, the crucial part, treatment. If a dog ate grapes, or you think they did, what needs to happen and how fast?
Speed is absolutely critical. The faster you act, the better the chance of preventing serious kidney damage. So, first step, if it just happens, say, within a couple of hours, is decontamination. Trying to get the grapes or raisins out of the stomach before they're fully absorbed,
How's that done?
usually by inducing vomiting. Vets have safe injectable medications like apomorphine. Sometimes, under strict vet guidance, hydrogen peroxide might be suggested orally, but the dose has to be right and it can cause irritation, so it's really best done by a vet or with their explicit instructions.
Okay, inducing vomiting. What next?
After vomiting, or if vomiting isn't possible or safe, the next step is often activated charcoal.
Activated charcoal. Like for water filters?
Sort of, but a medical grade. It's given by mouth, usually as a liquid slurry. It acts like a sponge, binding to toxins still in the gut and preventing them from getting into the bloodstream.
So get it out, then soak up the rest. Makes sense. What's the main treatment after that?
The absolute cornerstone is aggressive IV fluids, intravenous fluids given directly into a vein. We usually run fluids at a high rate, maybe 2 or 3 times what the dog normally needs to help flush the kidneys and support blood pressure.
And for how long?
Typically for at least 48 hours, sometimes 72 hours or even longer, depending on how the kidneys respond. We usually use fluids like 0.9% saline.
And while they're on fluids, lots of monitoring.
Constant monitoring, checking those blood kidney values, BUN, creatinine frequently, maybe every 12 to 24 hours, for at least the first 72 hours. We need to see those numbers coming down or stabilizing. We also monitor electrolytes, hydration status, and crucially, urine output. Are they making urine?
Right. What if they aren't making much urine, that oliguria or anuria you mentioned?
Yeah, if that happens despite the IV fluids, then we might need to step in with medications called diuretics. Things like furosemide or mannitol, sometimes even a drug called dopamine as a constant infusion, are used to try and kickstart urine production.
And if even that doesn't work, if the kidneys are really failing,
In severe cases where the kidneys have shut down, the options become much more limited and intensive. We might consider dialysis, either hemodialysis, filtering the blood directly using a machine, or peritoneal dialysis, using the lining of the abdomen.
wow, that sounds like a last resort.
It generally is. It's complex, expensive, and not available everywhere. But it can sometimes bridge the gap while hoping the kidneys might recover some function.
You mentioned specific drugs earlier, apomorphine, charcoal. Should owners keep things like hydrogen peroxide at home, just in case?
That's a really important point. While things like hydrogen peroxide and activated charcoal are used, giving them incorrectly can cause more harm than good. Hydrogen peroxide dosage is critical, and it can cause significant stomach upset or even aspiration. Apomorphine is prescription only. So the absolute best first aid is immediate contact with your vet or an emergency animal hospital. They can tell you if you should do anything at home, like induce vomiting and how, or just tell you to come straight in. Don't guess.
Crucial advice. Call first, always. Okay, so for dogs that do get through this, but had kidney damage shown on tests, what's the follow-up?
For those dogs, we need to monitor their kidney blood work until the values return to normal, however long that takes. The hope is always for full recovery, but sometimes the damage is permanent.
Meaning lifelong problems.
Yes, unfortunately. Some dogs might develop chronic kidney disease requiring ongoing management, like special kidney diets, maybe medications, regular vet checkups for the rest of their lives. And just as an interesting side note, some studies have noticed pancreatitis inflammation of the pancreas happening alongside the kidney injury in some of these cases. So that's another thing vets might watch out for during recovery.
Okay, so it can have long-term consequences even if they survive the initial crisis. All right, let's try to wrap this up. The big picture seems clear. Grapes, raisins, currants, common fruits, but a genuine, potentially fatal danger to dogs, primarily through causing acute kidney failure. And the cause, still kind of a mystery.
That's the core of it. Real danger, mysterious cause, unpredictable susceptibility, which means vigilance is key. If you know or even suspect your dog ate any amount, don't wait and see. Call your vet right away. Early decontamination and fluid therapy offer the best possible chance.
Definitely. It's been really illuminating, if a bit scary. A stark reminder that safe for humans doesn't always mean safe for pets. And it really leaves you thinking, doesn't it? If we still don't know the exact toxin in something as common as grapes after all this time, well, what other everyday things in our homes might hold hidden dangers for our animals? What kind of research or focus do we need to uncover these things before they cause harm? Something to ponder. Thanks for breaking this down for us.
You're welcome. Important topic.